Would you voluntarily drive a loved one to the hospital at 6 in the morning to have them put under and to have their brain shocked until they go into a seizure? I'm going to assume you said no. And why wouldn't you? That sounds like something from a deranged horror movie. Well, this is something that I have to do, sometimes up to 3 times a week for my mother. Why, you may be asking? It's for a treatment called ECT, and it is one of the last options we have to treat her depression. Now, we all experience sadness from time to time. Feelings of depression are a natural response to the stress of life, whether it be losing a job, losing a loved one, going through a divorce or breakup. It's common to have these feelings. However, some people have these feelings for long periods of time, months, years even. Feelings of depression so severe that they may want to take their own life. And sometimes they have these feelings for seemingly no reason at all. That's when the line is crossed between just having emotions of sadness and depression to actually having a mental illness. There are 3 main types of depression. There is chronic depression, which is characterized by mild to moderate symptoms, and it is long-term. Major depression is similar to chronic depression, however, the symptoms are much more severe. There's also manic depression, also called bipolar disorder. Symptoms of this include mood swings, so they will go from feeling symptoms of major depression to overly happy, almost aggressively happy, and the mood swings go back and forth, sometimes uncontrollably. There are other lesser types of depression, such as postpartum depression, which occurs after a woman has a child, and seasonal affective disorder, which occurs usually at the end of summer, the beginning of fall, when the weather starts to cool down, the days start to get shorter. However, these types of depression are generally less severe, easier to treat, and they are temporary. All of these types of depression share many signs and symptoms, which include sadness, feelings of worthlessness, feelings of hopelessness, guilt, low energy, no interest or passion in anything, even if it is something that the person had interest or passion for before. They may experience aches and fatigue, and in extreme cases, they will have negative, almost nightmarish thoughts, and even thoughts and attempts of suicide. Doctors are not 100% sure what causes depression. Some doctors think that it is genetics. Some people report having a family history of depression. However, some people do not have a history of depression in their family, and yet they experience it. Doctors also believe that there are triggers to depression, including stressful situations, like I mentioned, losing a job or going through a divorce. However, the person does not get past those feelings, and their negative emotions turn into a mental illness. Alcohol or drug use has been linked to depression, and sometimes other illnesses, such as cancer or something that causes long-term pain, or imbalances such as a thyroid problem can cause depression. No matter what the cause is, it is a very serious disease and should be treated. The disease is very common. Roughly 7% of adults in the United States will suffer from major depressive disorder. The average age of onset is 32. However, it can affect people of all ages, including adolescents. If depression is not treated, the the person may spiral into a deeper depression. And the deeper and more depressed they are, the harder it is to treat. If you get treatment early, it's more likely to be effective. Now, luckily, there are plenty of treatment options. There are medications, such as antidepressants. I'm sure we've all heard of Prozac. There's psychotherapy, including talking to a psychiatrist or a therapist. Usually, these methods work either by themselves or in conjunction with one another. However, some people, unfortunately, are resistant to these treatments. And that is where treatments such as ETC come into play. ETC stands for electroconvulsive therapy, and it is just as awful as it sounds. Like I mentioned earlier, the patient must go to the hospital to be put under anesthesia, and their brain is electrocuted until it has a seizure. The theory is that the seizure, the electricity, will cause a reset in the brain to revert their mind back to before they were depressed. And while some people are cured by medication, therapy, even ECT, some people are not. Everybody is different, and anybody with a mental illness should be taken seriously. Many people think, oh, it's in your head, get over it. Well, just like somebody could have a sick heart or sick lungs, you can have a sick brain too. Telling them to get over it is not going to work. You wouldn't tell a cancer patient to just get over it, would you? Of course not. That's horrible. So in the same sense, people with depression should be treated just like any other illness. It's a common illness. It can happen to anybody, but support and treatment is what is necessary. Thank you, and I hope you are more informed now on the mental illness of depression. Thank you.